Hi and welcome here in South Africa. Thank you for allowing me the opportunity to share a little bit about the work we've done in the region, specifically focusing on Zimbabwe. So I'd like to take you back to 2015 when I had the opportunity to do an outreach in the neighboring countries of Namibia, Botswana and Zimbabwe in partnership with CMLSA, the local patient organization here in South Africa. The objective of this outreach was to train our nursing teams on CML, but also engage with the patient communities in the neighboring countries as they themselves had not established CML-specific patient organizations at that time. This was an incredible trip because not only did we meet incredibly dedicated and passionate healthcare workers, but we got to meet patients in the neighboring countries that traveled really far just to come and meet with us and also learn about their disease and engage about what the future holds for them. The one country that stood out was Zimbabwe. The expectation on patient turnout during these meetings is usually low as we consider that patients really travel from far and few have funding just to get to the site for a meeting like this. However, that morning we walked into a room where 60 patients were waiting to hear what we had to say and to engage with us about their disease and their condition. I started the session by asking the patients in the room, how many of you have had the opportunity to meet another CML patient? There wasn't one hand that went up, and it was pretty clear that the patients in the room had for a very long time felt isolated and believed that what was happening to them was unique to them. As we started to discuss the disease, the symptoms, the treatment, potential side effects, the engagement in the room was incredible to see how patients started sharing and hearing from each other and learning from each other and feeling less isolated, and you could see a community starting. One of the things we did discuss in the session as well was the importance of PCR and monitoring. And the feedback from the group was that is something they did not have access to. They did not know how they were responding to their treatment, and they really had no idea what the outcomes were going to be. At the end of the session, a group of patients approached us and they committed and told us that they would be starting a patient organization in Zimbabwe. They would be providing support to other patients and they would be advocating for PCR. And that's exactly what they did. It wasn't a month or two later that I received the notice from the CML Trust Zimbabwe that they were an established organization, and the next step for them was to then actively start advocating for PCR. Easier said than done. Despite there being several gene experts in the country, they came into the same challenge that we hear so often, that the machines are dedicated to specific programs, either HIV, either TB, but the CML community did not have access to these machines. But where there's a will, there's a way, and this patient organization decided if everybody tells us no, we will just buy our own machine. And they started fundraising and getting the funds together to buy their own machine so they could have access to monitoring and PCR. They did a lot of great work and raised a lot of money. However, the political situation in Zimbabwe changed and the currency was depreciated to the extent where everything they raised was pretty much worth nothing. Earlier this year, Cethia donated a GeneXpert to the Max Foundation, which we could then donate to a needy country or patient community. And there was no doubt that Zimbabwe would benefit from this machine. The machine arrived in country in April, and I was very fortunate to be there at the time of the unveiling. It was such an emotional day to stand there with somebody like Onward that I met for the first time in 2015. So many years later, seeing how their lives are going to change because of this device or intervention. The same patients that came up to us in 2015 and said, "We will do this," had done it. This was an incredible day of celebration and seeing the impact of their work, of having heard their voices and now seeing the fruits of their labor. Their lives were literally changed. And I think all of us that witnessed it were there at the same time with them. The beautiful part about the story is not only the lives being impacted today, but is also about the lives that will be changed forever in the future. Dr. Ian Machamburu is the head of the lab and that is now housing this donated machine, also committed that the medical students that go through the lab will be trained in the application of the GeneXpert for CML, but also explained to them that the machine can be used for other disease areas and diagnostics. Therefore, when the medical students go into the rural clinics, they will see these machines and know that these machines have the potential to do more than they are currently doing and potentially change more lives. This is an example not only of a patient community starting and being established and advocating and actually fulfilling a need, but this is also a story of that need now affecting a healthcare system and strengthening that healthcare system moving forward. I look forward to see how the program in Zimbabwe continues to develop and grow. It is through the will of the patients, it is through the help of the global community that there is hope, that there is a future for so many today, but also a future for so many tomorrow. Thank you for spending the time with me today here in the hot sun. I hope it's hot and sunny where you are. And please reach out if you need to connect with us or need any more information. Bye.